This morning, as we're crossing over to 6:38 on this Friday, calls and texts from Iowans seeking help for suicide or crisis have significantly grown since the middle of July. Well, that's when the National Suicide Prevention Lifeline launched 988 as an option to text or call if you need help.
Yeah, this is such an important story to tell. So Local 5's Khalil Maycock spoke with organizations involved with the hotline right here in our state and joins us now live in studio to talk about just how the volumes of calls have increased in the past month, Khalil.
Good morning. And one of the two organizations involved with the hotline says since the launch, they've seen a 55% increase in calls over their monthly average for the last 6 months. And it's an increase they didn't expect would be so high.
988 Suicide and Crisis Lifeline. How can I help you today?
It's a little over a month since the National Suicide Prevention Lifeline switched from a 10-digit number to a 3-digit one that even allows texting.
If we took the average per month calls prior to the rollout of 988, in the last 30 days, we've seen about a 55% increase over that monthly average.
Emily Bloom is the CEO of Foundation to Crisis Services, one of two organizations that have been helping the state answer suicide prevention calls for years. The other is Community Crisis Services. Before the switch to 988, the average number of calls Foundation to Crisis Services received from January to July was 723 calls per month. In July, when they switched to 988, it rose to 1,121. The Iowa Department of Health and Human Services says the total number of calls 988 received for July was nearly 1,900. Now, this includes all calls from Community Crisis Services and Foundation to Crisis. And 988 received nearly 300 texts.
988 just helps with ease of access, and we are seeing call volume increasing, and we're doing our best to staff those, and I'm really proud of our team.
We were thrilled when 988 rolled out.
Bethany Kahotek works with NAMI Iowa. She says one of the best parts of 988 is not only did it shorten its number, but it improved the quality of care received when someone calls and is in distress.
So when someone's in mental health crisis, it's really critical that they are able to connect with someone who has the skills and the training to de-escalate the situation or to call in the appropriate resources.
Bloom says she is excited about the growth of 988 here in the state because it means they are helping more people in need, and they are making sure they continue to get staff to meet those rising calls. Khalil Maycock, Local 5 News, we are Iowa.